Hello, I'm Dr. Carolyn Ihrig, and my lecture at Academy 2018 in San Antonio is titled Low Vision Clinical Video Telehealth, Building the Low Vision TeleRehabilitation Team. One of the barriers partially sighted individuals who live in rural areas experience is the inability to receive low vision optometry rehabilitation because they are unable to travel, especially by automobile, due to uncorrectable vision loss. My lecture describes the initial pilot and ongoing low vision clinical video telehealth clinic offered by the Buffalo VA in Western New York. A main challenge for low vision optometry telehealth in general is that specific optometric testing such as distance visual acuity measurement, lensometry, refraction, ocular health assessment, and confrontation visual fields cannot be performed through clinical video telehealth. I'll refer to this as CVT. Therefore, my lecture will take you through the development of our multidisciplinary team, which includes the low vision optometrist at the Buffalo VA Visor Clinic and the local primary care optometrist and ophthalmologist at remote rural VA or non-VA facilities. By viewing and speaking to the patient through the CVT system, which I call video face-to-face, you are able to take the time to listen, answer questions, address concerns, observe, and customize care as you prioritize the patient's needs, which is the same consultation I have when they are sitting in my exam chair next to me. I hope you'll join me at Academy 2018 San Antonio for my lecture.